So starting with the important plant poisons, the first one here, let's learn it with the image. So what do we see here? What seeds are these? So these seeds, the image, if you see very carefully, this looks like some eye. This looks like a bug with an eye. This bug, it looks like an eye. So remember, this is called as crab's eye. Okay, this is called as crab's eye. Crab's eye is the other name for Abrus precatorius. Abrus precatorius. Remember, Abrus is like Crabrus. That is crab's eye, Crabrus, Abrus is the same. Precatorius, remember, is prick, and prick is equal to needle, right? Needle, prick. Needle in Hindi is called as sui. So remember, this is also used as sui as a cattle poison. Okay, sui as for cattle poison. This is red in color. Red is red. So remember, this is also called as Ratti seeds. Okay, Ratti or Gunchi. The other name for this is Ratti or Gunchi. Imagine like we're making a mala out of this, the red black mala out of it. So this is also called as the rosary beads or the rosary pea, right? That's the other name. So these are the important points for Abrus. And another important point, remember that this resembles the viper venom. Okay, it resembles the viper venom. This is an important question. So remember that Abrus resembles viper. The active component here is abrin. Okay, the active component here is abrin. Going to the next one that we have here, this has been asked in one of the recent INICET exam. So what seeds are these? So if you look at the seeds very carefully, this looks like the nib of a fountain pen, right? Or a pencil which has the sharpened end. So remember, this is used, this is looking like a pen or a pencil which is used for marking. So this is also called as marking nut. Okay, this is also called as marking nut. What is the name of this nut? This is called as Semicarpus anacardium. Semicarpus. Remember, M-E-C-A-R or M-A-R-C. M-A-R-C. This is the marking nut. So which is the marking nut? It is the Semicarpus. Right. The question asked here was, what is the active component here? We have bilavanol. Okay, bilavanol is the active component here. Okay, so because this is used for marking, this is also used for creating artificial bruise, right? So this is for artificial bruise. Since it is used for marking, this is used for artificial bruise, right? So this is Semicarpus. Going to the next one, before we go on to the next one, let's try to solve some questions related to Abrus and Semicarpus. A toxalbumin similar to the viperine snake venom is present in the seeds of Abrus precatorius, right? Abrus precatorius poisoning resembles, Abrus resembles viper, right? Abrus resembles viper. Sui needle used to kill animals are made up of sui needle prick. Precatorius is the Ratti seeds. This is the name, Ratti is the name for Abrus precatorius. All these are the previously asked questions, right? Toxic substance commonly used by washermen to put marks on the clothes, that is marking nut. Marking nut is Semicarpus anacardium. Remember, that is the marking nut. Next one, active ingredient of marking nut is semicarpol. It is Semicarpus. So semicarpol, also called as bilavanol. Also called as bilavanol. Artificial bruises are produced by marking nut. Capsicum seeds can be confused with Datura seeds. Remember, capsicum C के बाद आता है D. So capsicum seeds can be confused with Datura seeds. They look similar. Yunnan hand occurs due to capsicum, right? So remember that Yunnan hand. So Yunnan hand, basically dermatitis in the hand because of handling the chili. So capsicum, chili, remember it is the Yunnan hand. Yunnan hand is because of capsicum, haath mein chili, right? Going on to the next one, what seeds are these? This is Strychnus nux vomica, right? Strychnus, or which is also called as nux vomica. Okay, nux vomica. What is the active component here? The active component here is strychnine. What is the mechanism of action of strychnine? So remember, strychnine S and T, it is a spinal poison, right? It inhibits the presynaptic or the postsynaptic. Remember, ST, it inhibits the postsynaptic receptors of glycine. It inhibits postsynaptic glycine receptors, right, in the anterior horn cells. And that is how glycine is stimulatory or inhibitory neurotransmitter. It is the inhibitory neurotransmitter. So inhibitory is inhibited. So negative, negative, it's becoming positive. So there's a lot of excitation. So there is increased excitation. So you would see a lot of muscle contraction happening, similar to tetanus. Right, tetanus, similar to tetanus. So remember that which poisoning resembles tetanus is strychnine. Okay. So remember strychnine, when I write the ST helps me to remember it is similar to tetanus. It is postsynaptic. It is spinal. Right. So remember the S and the T there. And how do the seeds look of strychnine? So remember these concave seeds, the RBC shaped seeds that you see here. These are the seeds of strychnus, the nux vomica containing strychnine. It's a spinal poison. Look at the muscles going into contraction, the facial muscles. This is called as ricus sardonicus, ricus sardonicus. Look at the curving of the back. This is opisthotonus. Okay, this is opisthotonus can occur, pleurotonus, empristhotonus, all of that can occur with the muscles going into contraction, similar to tetanus. We'll look at some questions and we'll learn some more points about strychnine based on the previously asked question. So strychnine acts by inhibiting glycine. Respiratory center depression is caused by all except strychnine, because strychnine is not inhibitory. Strychnine, basically the action is excitatory. Okay, it is excitatory. So opium, depress, barbiturates, sedatives, gelsemium, remember, is also depressant. In strychnus nux vomica poisoning, the patient becomes unconscious. When does the patient becomes unconscious? Never. The patient remains conscious throughout. This is a previously asked question, important. Why? Since remember it's a spinal poison. It is not acting on brain. So that is why the consciousness is maintained. So the patient in strychnine nux vomica is said to have conscious seizures, right? It causes conscious seizures. In nux vomica poisoning, posture commonly assumed by the spine is opisthotonus is the most common. The antidote for strychnine poisoning is barbiturates. This is excitatory strychnine, so you want to sedate, calm the brain, right? So we will give barbiturates. Next question, Socrates was killed by which poisoning? So he was killed by conium. Now what are the points for conium? Conium is also called the poison hemlock. Okay, poison hemlock. So you can remember this as Socrates was killed in Havelock Islands in the Andaman. That is Havelock, hemlock, conium. Okay, he was given some cone and he died in Havelock. So conium maculatum, also called as poison hemlock. And remember, conium is like nicotine. Conium is like nicotine excitation बहुत ज़्यादा. So this is also a neurotoxin. Okay, this is also a neurotoxin. The nicotinic receptors are activated. That is conium maculatum, poison hemlock. Right? Going on to the next poison here, that is the aconite poisoning. Okay, that is the aconite poisoning. So aconite we will learn with an interesting story. So the story here is aconite, imagine, is like aconite. So there was an Aconite and all of us decided to go for Aconite, right? The concert. And this Aconite was in the month of December. Why December? Because it's very chilled, cold season and Aconite causes hypothermia. How did we plan to go? We went on our bikes, wearing the helmet, wearing the hoodies. So remember, helmet is the devil's helmet, the monk's hood. These are the other names for Aconite. There is hypothermia, December, chilled. So we are going. There were men also, there were women also, so it is also called women's bane. It is also called wolf's bane. Men are wolf, right? Remember, mesonephric duct, Wolffian duct, men, right? Next, when we reached there, look at this Acon performing. There are two groups of people. Some of us enjoying the concert because, you know, we love the Acon songs, the English songs. And some of us don't know Acon songs and we do not enjoy the concert. So we are, you know, not happy. We are very sad. So one happy group, one sad group. So this group is saying, बहुत ही अच्छा concert है. It's a मीठा concert, enjoying it. And this group saying, एकदम जहर है. You know, not enjoying it. It's a poison. So remember, this is called as meeta zehar is other name, meeta vish, meeta zehar. So this is the very commonly used poison for homicide. Okay, homicide. मालूम भी नहीं पड़ेगा किसने दे दिया, right? It's destroyed by putrefaction also, meeta zehar. So 1 hour to 5 hour is basically the duration that it requires to kill a person with aconite. So these people went home in 1 hour. These people stayed there for 5 long hours because they were enjoying. Now what happened? The people who were there in the concert near these loudspeakers, the loud music directly causes palpitations, affects the heart. So remember that it's a cardiac poison directly affecting the heart. It can lead to AV block. It can lead to arrhythmias. So what is the antidote here for AV block? We use atropine. AV block, cholinergic. So we use anticholinergic as treatment. Atropine is used. Some of us, we started dancing, not just us, but even our eyes were dancing. So the eyes were contracting, dilating, constricting, dilating pupils. That is called as hippus. So even the eyes were dancing. So that is hippus. Then of course we felt hungry. Attending the concerts, we checked the stalls there and we found one interesting stall where it mentioned that this stall is serving steaming hot horseradish. So there was an interesting dish that we saw, the horseradish. Okay, so this was the plant there. This was the plant and this is the horseradish, the roots of that similar to horseradish. So aconite roots resemble horseradish. So we said, let's try this, right? So looking at that, our mouth started watering, so a lot of salivation happening, hypersalivation happening. We ordered one dish and even though it was steaming hot, we could not resist ourselves and we ate steaming hot. So what did it lead to? It led to paresthesia of tongue and mouth when you eat something very hot. So remember that these paresthesias of tongue and mouth, tingling, numbness are very important features of aconite poisoning. It basically acts on the sodium channels. So first it causes a lot of excitation, then there's sort of paralysis, so there is tingling and then there is numbness. Right? So these are the various points that we learned for aconite. What did we learn is aconite in the month of December, so there is hypothermia. What are the clinical features? There is hypothermia. What did we go on? Our bikes, wearing the helmet, right? So the devil's helmet, wearing the hood, the monk's hood are the other names, the women's bane, the wolf's bane. These are the other name for aconite. It is also called meeta zehar, right? Meeta zehar, meeta vish, homicidal poison. Affects the heart. It's a cardiac poison, right? So what do we use in the antidote? It's the atropine. It causes AV block, bradycardia, hypotension, right? Also remember that some of us who were standing for long times, we got tired and we got hypotension or hum gir gaye. So hypotension is a feature, not hypertension. So there's hypotension that is seen here. There is hypersalivation. And we eat steaming hot, so paresthesia of mouth and tongue is what happens, and it resembles, the roots resemble the horseradish, right? So remember that this is how the plant of aconite looks like. You saw the image here as well, that blue color plant. This is the aconite plant. The most important image here, the roots, the aconite roots, they resemble the horseradish. Okay, the aconite roots resemble the horseradish. And remember that the roots are the most poisonous part in the plant, though all the parts are poisonous. Okay, all parts are poisonous, but the most poisonous are the roots. Okay. Look at the other ones. Which are the other cardiac poisons? We said that aconite is one cardiac poison. Which are the other cardiac poisons? The other cardiac poisons you can remember as acon, right? Remember acon, and it is dawn. Acon is a dawn. So acon, you can actually write it as acon, AQ. So acon, aconite is a cardiac poison. Q is quinine. Q is quinine. DON is digitalis or digoxin. Then you have oleander. Okay, then you have oleander and then you have nicotine. These are the cardiac poisons. So remember that acon is a dawn and directly affects the heart. Okay, so like we saw, affecting the heart. So acon is a dawn and directly affecting the heart. So aconite, quinine, digoxin, oleander, and N for nicotine. For nicotine, remember an important feature, it also causes amblyopia. Vision is affected, it can cause amblyopia. That's an important point. Oleander, right? That is your white oleander, the yellow oleander, Nerium is there, Cerebra Thavacia is your yellow oleander, right? These are oleander. Digoxin we know acts on the heart. It acts by inhibiting the sodium potassium ATPase channels, and for treatment you need to give digibind, right? Digibind is the best treatment for toxicity. And then you have aconite and quinine. So this plant which you see here, which has these dots over it like a purpura, you know how the purpura is, the dots on the skin. So this is purpurea, this is digitalis purpurea. What is the other name for digitalis? Remember digits. What do we wear in the digits? What do we wear in the digits? We wear a glove. So remember, the digitalis is also called as foxglove. Okay, that's the other name for digitalis. It is also called as foxglove. Coming to the next plant here, look at the seeds which are looking like a cockroach. Cockroach के जैसे seeds दिखने वाले. This is castor oil वाला. This is ricinus. Okay, remember this is ricinus communis. Okay, what is this? This is Ricinus communis. So remember, for Ricinus communis, the points that you need to remember is first one, R for red color plant. It is the red color plant like you see here. Okay, look at this red color plant and look at the plant which looks like the thorny appearance, like the cactus. Red but like cactus. So the three C's for Ricinus communis: red, cactus, right? The other one is the castor oil comes from it. The castor oil is non-toxic, but the residue of the seeds is toxic, right? And the cockroach seeds. Okay, remember the cockroach seeds. Remember the three C's. It is like cactus, red cactus, castor oil, and the cockroach seeds. So this is the castor oil, this is like cactus, and this is the cockroach seeds. This is Ricinus communis. Okay. And the toxin of Ricinus communis, that is the ricin. How does it act? It acts by inhibiting the protein synthesis. Okay, remember it acts by inhibiting the protein synthesis. That is the mechanism of action. Coming to the next one, let's solve some questions. All are cardiotoxic except, so remember econdon directly affects the heart. So in the O, it was oleander, not the opium. Nicotine, aconite, oleander are cardiotoxic. Opium, brain पे act करता है. Meetha vish, meetha zehar is the name for aconite. Characteristic symptom of aconite poisoning, you see increased salivation, there is hypotension, tingling, numbness, there is hypothermia. So both of these are present. If we have to go with one, the better answer is tingling and numbness. Not a sign or symptom of aconite poisoning. Out of this, the best is hypertension. We know that it causes hypotension. Remember the people falling down with hypotension. Active principle of oleander plant. Remember the nerium and the cerebria. So remember it is nerin. Nerium is nerin. Okay, nerium is nerin. Oleander plant. So that was about these questions. Now going to the next one, Datura, which is basically a deliriant poison. Right? Remember it causes muttering delirium in the patient. So it's a deliriant. Now the Datura is also called as like the apple thorn. So again it is the thorny appearance that you see here, but it's a single thorny appearance that you are seeing here. Okay, and look at the white flowers of Datura. So this is the Datura. Again it has this horny appearance, and look at the seeds of Datura. We saw earlier C and D. Datura seeds and the capsicum seeds can look similar. The difference is Datura is brown color here. This is yellow color. Datura has this shape. This is more circular, right? This is more circular. This is more kidney shape. Datura is brown. Capsicum is yellow. Okay, so remember this is Datura. Now in Datura, the toxins, the active principles that are present is hyoscine, hyosamine, and there is atropine, right? So these have anticholinergic features. Atropine, anticholinergic features. Remember Datura D causes the 9D symptoms. That is dryness everywhere, right? There is no sweating, no secretions, it's dry. The 9D by itself does not include the dilated pupil, but remember that dilated pupil is one of the feature that you see here. So there is dry, there is dilated pupil, there is delirium. Okay, this is hot as a hair. So it is increased temperature, hyperthermia that we see. Hot as a hair, red as a beet. That means there is flushing. Dilatation of the cutaneous vessels is what we see. Okay, so hot as a hair, red as a beet, all these are the features. There is delirium. This is also called as the railway poison or the roadside poison. What is the drug of choice for Datura? Because this is anticholinergic, so we give a drug which increases the acetylcholine levels, that is physostigmine. The drug of choice is physostigmine. Why? Because it crosses the blood-brain barrier and it is acetylcholine esterase inhibitor. That means it will increase the levels of acetylcholine by preventing the degradation by acetylcholine esterase. And the general history that you have is a child while playing ate some fruit from the plant. Okay, that's the classical history that's given in Datura. Generally, the drug of choice is physostigmine. Similar features you would see with this plant as well, which is black color. So remember, this black colored, the features is similar to Datura, that is like atropine, is this plant which is Atropa belladonna. Okay, this plant is Atropa belladonna. So belladonna, remember, belly dance. Okay, the females doing belly dance at night, right? So remember, this is also called as the deadly nightshade. Okay, the other name for this is the deadly nightshade, and the night is dark, so it is black in color. So if you see this black color, it is like night ke jaise dark, a nightshade, that is belly dance, Atropa belladonna. Atropa, this is similar to your Datura poisoning. And if the other way around, if I ask you that atropine is the drug of choice for which poisoning? So remember, for mushroom poisoning it is used. So you can remember, mushroom has muscarinic symptoms. So to block that, we give atropine. And the other one is the OPC poisoning. OPC, the treatment of OPC is atropine. Okay, atropine, treatment of OPC. Treatment of OPC is atropine. Okay, so OPC poisoning and mushroom poisoning, we give atropine, right? So remember, that's for Datura. Let's solve some questions. Following is not present in Datura. Muscarin is not present. It is anti-muscarinic. It has hyoscine, hyosamine and atropine. Next one, the police brought a person from railway platform talking irrelevant, dry mouth, hot dry skin, dilated pupil, slurred speech. All these are features of Datura poisoning, right? The DDD, dryness, dilatation and delirium. Datura poisoning is characterized by not the pinpoint pupil, it's dilated pupil. So it is dilated pupil with facial flush, red as a beet. Not decreased temperature, it is increased temperature. Hot as a hair, red as a beet. Dilated pupil is seen with D4D, dilated pupil is seen with Datura. Opium causes constricted pupil. Okay, opium causes constricted pupil. Mushroom, pilocarpine, all these are cholinergic, cause constriction. Okay, so remember that cholinergic, you can write it like this, cholinergic, CO causes constriction. So pilocarpine mushroom will cause constriction. Okay. The next one, muttering delirium, is seen with Datura, DD. Treatment of Datura poisoning is done with physostigmine, acetylcholine esterase inhibitor crossing the brain. All are true about atropine poisoning except it is not the decreased temperature, it is the increased temperature. Atropine poisoning is like Datura, hot as a hair. Okay, this is hot as a hair. Dilated pupils, dysarthria, dysphagia can be seen. Next one, Ramesh presented with bronchodilation, increased temperature, constipation, tachycardia. What is the poisoning with? Mushroom is muscarinic. Muscarinic cholinergic will cause bradycardia. OPC, again they go hand in hand, right? So this is opposite of it. This is atropine poisoning like Datura. Okay, so remember it causes dilated pupil, bronchodilation, increased temperature, constipation and tachycardia, right? So that was about the important plant poisons, where we have also seen about strychnine, right? The spinal poison. We have also seen the cardiac poisons, and we have seen about Datura, which is a deliriant. I hope these tricks help you to remember this part of toxicology. Thank you.